Hi everyone.
Welcome to our podcast, Health Data Decoded.
I'm Ed Hill.
And I'm Samuel Ball.
We are researchers working at the University of Liverpool in health data science, and we are part of CHILL, the Civic Health Innovation Labs.
CHILL's an interdisciplinary team of researchers, NHS staff, local government and charities looking to use data and artificial intelligence to improve health outcomes in a responsible way.
This work, as well as bring innovation and improvement to health, can also help with our social well-being and the economy.
In this podcast, we'll be interviewing collaborators, researchers and professional support staff within CHILL to better understand what they do in their roles to improve health outcomes for the local area.
We'll be delving into questions such as, what are their day-to-day tasks? How did they get into the role that they currently have? And what advice would they give if you are interested in getting into this area of work yourself?
So join us in our journey to understand better how we can use data to tackle global health challenges and local ones within the Liverpool City region.
Hi everyone, and welcome to our latest episode of Health Data Decoded with me, Ed Hill.
And me, Samuel Ball.
And today it's great to be joined by Andrea Astbury. And so we're going to be delving into perhaps some of the aspects related to perhaps like a project called Data into Action, aspects about program directoring, and linkages of CHILL with public health agencies. So Andrea, thank you for joining us. And so would you like to just kind of introduce yourself and your role and basically who you work for?
Yes, absolutely. Hi, good afternoon. I'm Andrea Astbury. I am the Data into Action Programme Director working across Cheshire and Merseyside. So I'm employed by the NHS, but I do work very closely with the Civic Health Innovation Lab, the Civic Data Cooperative, and lots of other partners across the university and other partners beyond that, really. So thank you very much for inviting me today.
Thank you for joining us. And it's going to be our first episode, I think, where we have a guest who is, I guess, not main role is not based within the University of Liverpool. So I think it's fantastic, and thank you for taking the time to join us.
Yeah, brilliant. So we know that you're the lead director for Data into Action. We've got lots of different schemes involving data within CHILL. So can you just introduce to us kind of like the remit of Data into Action specifically?
Yeah, I mean, it's quite a complex programme, I think that's fair to say. And it really came about because we knew that we had a lot of kind of disparate programmes of work, I think, really, who had very much a sort of aligned agenda or, you know, very much like a Venn diagram of overlapping agendas. And in essence, we brought all of those together under the Data into Action programme governance so that we could really optimise the benefit of all of those different pieces of work happening in separate sort of entities, really. So I work very closely, as I say, with the university. There's the Civic Health Innovation Lab, but we've also got strong partnerships with commissioning support units, which are entities sort of within the NHS infrastructure, and they'll do things like data processing for us. Also partners who have got expertise in information governance, our public health colleagues from across the patch, which is represented by the sort of CHAMPS network that people might be familiar with, but also, you know, we've got a raft of provider organisations working across health and social care in the Liverpool City region and across Cheshire and Merseyside, where we've got a really quite complex provider landscape. So it's about bringing all of those together, as well as all of the kind of corporate functions and the place-based teams that exist across Cheshire and Merseyside. So we've got 9 different places within Cheshire and Merseyside, which is sort of our local authority boundaries. So it's about bringing all of these different pieces of work together so that we could join up our programme of work to have bigger impact.
Yeah, I mean, I suppose it just makes sense, doesn't it? If multiple people are doing the same work, then to kind of get people to talk to each other about how they're using the data and data sharing. In fact, last week we talked last episode we talked to Albert, who's a data engineer, and talking about information governance and how to keep all the data safe. One of the questions I had was we've talked to a program manager on the podcast before, but not a program director. So I think one of the questions that I would like to know really is what is the difference between a director and a manager in kind of the sense of a program like the DIA?
Very good question. I think probably some of the key differences is that with a program like this is that we've got something like over in partnership with our population health team in the integrated care system. There's something like 250 different projects that are all happening across different teams, different entities, people who want access to data, all range into something that is a much bigger transformation program. So I think the program management role is more about trying to keep a handle on all of that and ensure that we prioritize those pieces of work most effectively. Whereas as a program director, for me, it's much more about really sort of setting out that longer term vision and strategy, ensuring that that aligns, particularly from my perspective for our integrated care board, so that we're very much sort of doing big transformational pieces that we know marry with their agenda. And that'll be things like obviously, we've got a lot of proactive care models, for example, that we're starting to establish, which should have a big impact on urgent care and system pressures. So it's about trying to make sure that we, as a program director, that I shape the program of work to ensure that it really hits those big strategic objectives. So as I say, for the ICB, but also, really important that we have a mutual relationship with the university, so that not just in terms of providing access to data, but we want to make sure that the outputs of those publications, that insight and intelligence, then actually is used in practice. So I think the difference there is just about trying to make sure that we've got some of those connections and that those different programs of work are really complementary. So a bit sort of internal versus external, I think.
Thank you for that summary, and I think that's really kind of makes clear the distinction between kind of what program managers and program directors in terms of what their remit might be, but also shows how they're both very important roles. And as we're getting the sense across these episodes is every role obviously has a very integral function for these public health projects to deliver the most benefits and hopefully ultimately help improve the health of the kind of community. And in terms of your own kind of background and then how you ended up as a program director, would you like to share with the listeners kind of your how you ended up in your current role and then your perhaps past experiences?
Yeah, so I've just had 22 years worth of service across the NHS.
Wow.
Which does make me feel a little bit older than I'd like to. But I've worked across a range of different organisations, and that's been hugely helpful from developing a system perspective, I think. And that is what is really crucial to me about data interaction, is that this isn't just data that we look at in sort of really siloed, singular service kind of perspective. What I'm really interested in is the power of looking at that across systems so that we can better meet the needs of our populations across different communities, different cohorts, etc. And to bring organisations together to be able to not just think about what their individual service does, but actually, for some of our patients and communities, they'll be in receipt of a huge amount of interventions, feel like they're being done to in many respects. So I think that kind of background I've had, where I've worked across acute providers, I've worked in the community and mental health trusts, I've worked as both a commissioner and in provision within health. And that has been really helpful, I think, to sort of try and understand, just the complexity of just the NHS in and of itself. But obviously, as we broaden that out into working with local authorities and other key parts of the public sector, that's where the big opportunities lie as well. So, yeah, I think it's just, all of that kind of experience in different sectors has helped bring me to this. I think the role that I also did just prior to data interaction was around a programme called System P, which was about using linked data to really target interventions at some of the most vulnerable cohorts. So that programme is a little bit more narrow than what data interaction is. And as I say, that's why we've needed to make sure that we don't just have singular sort of data-led projects sitting in and of themselves. We really wanted to connect them to different parts, and that has been hugely beneficial. And I think one of the best examples of that is the work that sort of the Civic Data Cooperative have been doing around engagement with the local population. we've really felt that benefit in data into action of connecting into that agenda. So yeah, so this is where some of the history has sort of led us naturally, I think, into the evolvement of a bigger, more integrated programme.
I think that's super, and it's a wonderful wealth and blend of past experiences there. And so yeah, well, and thank you for the 22 years and for many more that will follow with that you've had with NHS.
So Andrea, I know we met at the LCR event where we kind of interacted with the public and we heard more about kind of what they thought about usage of data within the CDC. I thought one of the most interesting parts of that event was when members of the public got to go around to all the different projects that were being done by the CDC and data interaction. And I just think, from my perspective, as someone who's a little bit outside of kind of like the kind of holistic view, the whole view of how these services interact with each other, I thought it was really interesting to see, so for example, how the fire service was working with data to make sure that the kind of checks that they were doing were being done in an effective way. I think our listeners would really like to kind of know what your kind of favourite example of a project where data was being used in a way to make a big impact to people's health that perhaps isn't necessarily what would be thought of as a data project in the first instance.
That's a good question. The example I started to think of, that was a good example of sort of the partnership really, was the work that we've been doing around complex households, which the university massively influenced our thinking in terms of not just looking at cohorts of the population with certain conditions, but what we've really sort of dug into with the insight is the importance of the additional sort of broader determinant kind of issues such as poverty and an environment, but it, it's just that much more nuanced context that actually, people who perhaps have got a lot of complexity and sometimes chaos at home are going to struggle to engage with health and care services in a routine way, and actually some, tend to have a lot of health and care services, but their outcomes are still not improving, or they're not in line with the general population. So that's been a really important piece of work, and it's one that we did share at that session, because I think the power of extending our current data sets around that cohort should be, a real game changer. We've already developed a dashboard which helps us find some of the most vulnerable families, and it's been really powerful and interesting, because actually some of our GP colleagues locally, despite the fact that they know their families really well and their patients on their caseload really well, but actually some of these people perhaps their needs are manifesting in a slightly different way, and the data can really help bring that to life. As we expand our potential data sets, and obviously we were asking the public at that session, what do they feel comfortable with in terms of extending it maybe with education or, additional sort of housing data sets, that kind of thing. The more sophisticated our data can be, the better our understanding of those populations can be. And I think, the public sector can work much more powerfully together rather than just in kind of the silos that we currently operate. So I think I've partially answered your question there, but I'm just trying to think what I've missed.
Yeah, no, definitely. I mean, we were talking about this with Albert in probably just after the episode. In that event was really interesting, because you had, I think there is a significant wave about there's almost like a frustration with data in that why aren't local authorities talking to each other, but then there's also this kind of additionally valid angle of people saying that they kind of want that control over their data. So I think what the CDC was doing by basically going to the people and saying, okay, you guys, kind of, what do you want out of it? Like, where do you want us to strike the balance? I was really inspired by that, actually. I thought that event was really good.
And from my own perspective, thinking about, I was quite interested in the public involvement, public engagement side, and bringing the public on the journey, research journey, and then being embedded as part of the process. And then it's like inherently like developing that kind of mutual connection, that trust between us. So what is the research that we're doing? What is its purpose? And then that being something which is useful and then has a benefit for the public in conversation with them. And then longer term, basically we've built that bridge, that foundation, that means. Then think about data interaction, then the data that's being used, that we can like maximize its potential essentially. So I quite like data interaction just as the overall kind of umbrella term, because it's like it just makes very clear in terms of what is its purpose, what is it trying to do, and the fact there is perhaps people might say there's so much data now, but it's like, okay, but what use is that if we don't do anything?
Exactly.
You might be using it in some way, but is it being used reasonably and effectively? So
absolutely. Yeah, and I think what was great as well at that Liverpool City Region event was one of the most sort of compelling messages that came out was that actually if we're using data for public good, then people are broadly supportive of that. And I think the more transparent we are about how we're using data and the value that brings, as you say, really, it's about sort of, developing that trust and having that sort of mutually supportive dialogue with the public. So I'm really pleased that it was such a positive event to be part of. I'm sure we'll be building upon that over the next couple of years as well.
So one of the kind of questions we're asking everyone really is, so that I think there's a load of things that you expect to do in a role when you join it. So as a lecturer, obviously you're expecting to do some teaching and some research. But there's usually some other bits that you kind of don't really expect to do in the job. So really, this is kind of part of one of the weird parts of my job that I love. But I was just wondering if there was any areas in your job as a director that you thought that you weren't really expecting to do when you joined the role, or things that might be a little bit different that people might not expect you to do in the kind of director area of things.
Yeah, I mean, it's a really interesting role and it's constantly evolving, and we're being, pulled into lots of different directions. So no 2 days are the same. I mean, I think, finding out more about, the sort of information governance and sort of the nuances around that's been quite interesting, and perhaps, something that I hadn't expected when I'd, first come in or wasn't as knowledgeable around. And as well, I would say about the patient and public engagement work as well, that's been really interesting for me to be part of that and to really see the value of that. And we've recently developed a patient and public advisory group as well within data interaction. So I think we're seeing how important it is to strengthen that component part of the programme and to draw upon the expertise that we've got locally with the CDC and other partners. So I think those are a couple of the areas that's certainly been interesting for me from a personal development perspective, as well as actually building our population health management academy. I originally thought we might embark upon something like that, but we have developed that, and again, the university has been a key partner in terms of upskilling analysts across the system. Whereas, as well in my role, I've been really keen about how we skill and empower the people that we work with to lead some of those transformations using data. So again, that's just been really rewarding and something that I think we'd absolutely want to build upon over the next couple of years.
That's super. I think so. You've kind of like suggested where kind of the vision might be going in upcoming times, and you've already mentioned basically like day to day things can be very, very different from one day to another. So perhaps in terms of future outlook, and are there any kind of drastic kind of changes in the type of, like within your role, like the type of responsibilities that you might have, or just like different types of events or functions that could arise? So perhaps in recent times, perhaps now in bringing more public involvement, etc. Do you anticipate that continuing to grow, or other examples of areas where there might be a kind of expansion of activities?
Yeah, no, that's a really good question, actually. And yeah, I do think that kind of engagement work absolutely needs to strengthen and grow. And I think greater visibility and transparency around that, as I said. I think also in terms of where the NHS, the direction of travel for the NHS is and for integrated care boards is the role around strategic commissioning. And that is really, again, as to say, like using system data to really affect system change. That's going to be be hugely important for health, and we can see a direction of travel where we're moving more towards outcomes-based contracts, population-led sort of developments, working with our provider organisations and others quite differently. And data is absolutely central and crucial to that. And we're so fortunate to have the linked data asset that we've got in Cheshire and Merseyside to enable that. But I also think the work around public sector innovation is going to be a really important direction of travel for us, and we're doing work with the team across the city region in order to test proof of concepts in that space, and that is a big data-led initiative, so we'd be really keen to expand further into that Office for Public Sector Innovation.
Brilliant. Yeah, so we're asking everyone kind of as the kind of closing thoughts, really. If more people want to get involved with how their data is managed and using their data to help kind of public health outcomes. So I know we've talked about the kind of public health forum and getting involved in PPI, but how can people get involved in these kind of projects at a larger scale to help out?
I mean, it's a really good question, and I guess there's a number of different inroads to that. And I think actually it makes me think about some of the outputs that we discussed, or some of the principles that are coming out of the residents' assembly work, which is about local people knowing about how the likes of data and AI is being used in services that perhaps they're interacting with. So I think there's probably a role for all NHS organisations and other public sector organisations to be a bit more, to be transparent about that, and to show the power of how this work is, transforming the way in which services operate. I would also say we've got, a lot of information on our data interaction website, and I know that there is a huge amount of information as well on the University of Liverpool website. So I guess it's incumbent upon us to make sure that those interfaces with the local public are displaying everything that's happening, and showing the opportunities for people to connect in. I think the scale of the work that was recently done with the Citizens Assembly, the outreach was significant, and I think continuing to develop those kind of programs is going to be hugely important. So lots more to think about, I think. I think there's further consideration that's needed, but I think we've got a really sound platform upon which to build.
Brilliant. Thanks, Andrea. That was really good. So thanks everyone for listening. If you want to follow us on Blue Sky, you can find us at Chill.
And feel free to leave us comments on Spotify or YouTube, or go wherever you're listening or watching us.
All right. Thank you for listening. Goodbye.